Hi, everyone. It's Dr. Linder again. We are going to finish up with the kidney and the rest of the urinary tract. We're going to focus, just do a quick little review, and then we will look at the urinary bladder and probably finish up with some, common pathologies or, some common issues that may arise. That's pretty common involving the urinary tract and the kidneys. So just to review, I really kind of like this picture because it kind of shows the importance of a few things. Remember the blood circulation, how it comes off the abdominal aorta, then you have the renal artery, and then the segmental artery, and then the interlobar artery. And then the interlobar artery leads to this right over the pyramid, right, which is the medulla, that portion. And then at the base of the pyramid, we have the arcuate artery. And then this is extending into the cortex. So it's called the cortical radiate artery. Now, off the cortical radiates, we have the afferent arteriole. So the afferent arteriole, which is right here, is leading into that capillary system where it's held into the Bowman's capsule or the renal corpuscle. And that's the glomerulus. And then that's the larger diameter blood vessel. And then exiting is the efferent arteriole. Okay. Now, wrapping around the proximal and the convoluted tubules are the peritubular capillaries. Remember, peri just means around. So peritubular means it's around the tubules that we can see here. And that's a little bit different than in the lower right. We see the vasa recta, which is this blood vessels, this capillary system that surround the loop of Henle. Okay. So going back, we have now filtrate being pulled out into the proximal convoluted tubule. So that's the first part. Then we have our descending limb of the loop of Henle. And right here, it's the thick descending limb. Then here, we have the loop of Henle. Then we have the ascending limb going up this way. It's kind of interesting. Let me see if let me follow this to make sure that it's right, because this is going around this way. This is proximal. Okay. Let's go through this again. Let me just erase this and I'll show you how important it is. Let's erase and let's go back. So if we follow this is now proximal. This is proximal convoluted tubule. I'm following it. It's going around. Now, right here, it crosses over. So this is where it tricked me. It did a number on my eyes. So if we follow it this way, that's why this is the descending limb. And because it's thinner from here to here, they call it the thin limb of the loop of Henle, but it's thin. Here's the loop. And now we're ascending up, and that's the thick limb, because it's obviously thicker. Right? So originally I thought it was going this way, descending limb, but at closer look, I said, why is that labeled that way? Maybe it was a little convoluted, and it was. So now you have the descending limb coming this way. You can see here's the thin part of it, then the loop of Henle. Now it's going up, so it's the ascending limb of the loop of Henle, and they call it the thick limb because it is thicker. And now here is the distal convoluted tubule. Let's follow it. This is all distal convoluted tubule coming up and around. And now, let's see if we could follow it. I'm going to do it in black. So this is where it gets a little tricky on my eyes. Now it crosses underneath. It disappears and comes around this way. That's all distal. So then right around there, that would be that one section that we see, the cross section of the JG complex, the juxtaglomerular complex that has the macula densa cells and the granular cells and the mesangial cells, the chemoreceptors, mechanoreceptors that kind of regulating whether EPO, erythropoietin, or renin is going to be released. Okay. All right, so that's distal convoluted tubule, and now it's coming around. This is a connecting duct. This is a connecting duct, connecting. We have all these connecting ducts that lead into the collecting duct. And then right down there at the bottom, that would be the papilla or the papillary duct that would open up into the, from the medulla or the pyramid into the minor calyx. Okay, and then from the minor calyx to the major calyx to the renal pelvis into the ureter. And now the ureters, they come down this way, and they're coming down this way, and then the ureters are going to lead right here into this uteral opening and this uteral opening into the urinary bladder, and that's what we're looking at here. They lead into the urinary bladder, and then it will dump that urine right through here from the internal urethral opening. Then there's an external urethral opening, and this is muscle. It's deep muscle, and it can be voluntarily controlled, open and closed, to release urine or not. Okay. Urine is stored here in the urinary bladder. By the way, this region of those 3 points, the 2 uteral openings plus the internal urethral opening, they call that the trigone right here, because it makes up a triangular region, those 3 points. The muscle surrounding the smooth muscle surrounding the urinary bladder is called a detrusor muscle, which will actually contract to push the urine out during micturition. And then we have the urethra, which is the passageway for urine or for discharge out of the human body. Now we can compare. Actually, so let's look at this. This is really important since we're talking about urination and the urinary bladder. Certain diuretics. We know that caffeine is a diuretic. Many people drink caffeinated coffee, and it makes them urinate or increases the urination. And that's because it inhibits sodium ion reabsorption. So if there's sodium, water is going to follow. Alcohol is a diuretic because it inhibits the release of anti-diuretic hormone. Anti-diuretic is going to hold on to water. So if you're inhibiting that, you're going to have increased urination. Of course, diuretics, the drugs like Lasix or Diuril, these are loop diuretics. They too inhibit the sodium associated symporters, moving things out together, symbiosis, symporters, not anti-porters. And then high glucose levels. If glucose levels and sugar levels are high, your body's going to want to push it out through any means possible. And that's why with diabetes, the 3 Ps are polydipsia, drinking more, polyphagia, eating more, and polyuria, urinating more. Discharge of urine involves the voluntary and involuntary muscle contractions. There are stretch receptors that will trigger the spinal reflex, and that's how we learn to control urination in childhood. Remember, the frontal lobe is involved with that to inhibit the ability to urinate. And the urethra carries urine from the internal urethral orifice to external, to outside of the human body. In males, the urethra is involved in also discharging semen, not just urine. So let's take a look and contrast the male and female system. So on the left-hand side, we're obviously looking at the male, and on the right-hand side, we're looking at the female. So on the right-hand side, we have the testes. The testes are held in the scrotum, the sac that is held outside of the human body, primarily because it's 3 degrees cooler out there, which is ideal temperature for sperm formation. And if for any reason the temperature drops or it's too cold, then we have musculature here that can pull the testes up closer to body temperature, core temperature, to warm them up a little bit. Other structures that are very important. Here is the prostate gland, and we see that part of the urethra passes through the prostate, and it's just called a prostatic urethra. And that's why during BPH, or benign prostatic hypertrophy, the prostate can get inflamed, and when it gets inflamed, it just doesn't grow larger outward, it grows inward, and when it grows inward, it can compress the urethra, so the male feels like he has to urinate, but when he tries, nothing. Okay, look at how close the prostate is to the rectum. And that's why prostate exams given by physicians, they typically insert the finger through the anus and palpate anteriorly, and they're feeling for enlargement of that posterior lobe. That's why digital exam of the prostate is so important. They can palpate an enlargement of the prostate. In addition, in blood work, I always check on men the PSA levels, the prostatic specific antigen levels. We typically want that healthy level between 0 and 4. If it's higher than that, it usually indicates some metabolic activity of the prostate. Some serious conditions would obviously be like a prostate cancer. So you have the prostatic urethra, and then going through the shaft of the penis is now the spongy urethra. Okay, and you could see that the urethra is quite long in the male compared to the female. If we look at the contrast, the urethra is 5 times longer in the male than in the female. It's shorter in the female. The urethra is divided into 3 segments in the male, but it's one short tube in the female. So we talked about the prostatic urethra and the spongy urethra, and between the two is the intermediate urethra, no biggie, okay? The urethra is a common duct for urinary and reproductive systems in males, and these two systems are entirely separate in females. So here, there's just one exit route for urine and for reproduction, right? For sperm and semen ejaculation. On women, okay, we have one exit, which is the anus. We have the second exit here, which would be for intercourse and baby to exit. And then we have this one here, which would be for urine and urination. And this is why it's very, very important. I remember when I was an intern, I think I was 20 or 21 years old, and I was in the clinic treating patients, and I was doing a urine analysis on a young lady, and we did it both ways, not just dipping a stick, but we actually took urine, put it under a microscope, and would examine it to see if we saw any crystals, any bacteria, any pathogens. And this young lady had lots of bacteria running rampant. She was actually had a urinary tract infection at the time. And it just so happened that she needed to be educated on proper wiping techniques. Now, we can't assume that every young lady knows or is taught proper wiping, which should always be from anterior to posterior, right? Here's the pubic bone. So wiping from front to back is proper, but many young ladies wipe from back to front. And the problem with that is they could be bringing bacteria from the rectum and anus up into the vaginal area, okay? And there could be a UTI, or a urinary tract infection, that develops. So I have to be very careful. We can also pick up yeast overgrowth. I'll show you what that looks like on a slide as well. So because women have a shorter urethra, it's very common for women to get UTIs, not just from improper wiping, but it could be from if, proper undergarments, if a woman is wearing a thong type of bathing suit, and then you get that thin rubbing going from the anus to the vaginal area. You stand, you sit, you stand, you sit, and you get this movement of bacteria from the anus to the vaginal area. Very common, very, very common for young ladies for that to happen. Let's look at some of the buffering systems, or I should say waste management. How does the body get rid of some of its toxins? There are body buffers. The body uses blood, and it uses antigens and antibodies, and it uses white blood cells and neutrophils and monocytes and macrophages and basophils. The lungs can get rid of waste through exhalation. We can get rid of it through sweat, through bowel movements, the GI tract, and even the lungs. Even the liver. And I want to show you, I'm going to create a separate video on liver detoxification because I think it's important.